I have worked on green building issues for many years for the state of California. I'm now doing some consulting and volunteer work, and I thought I would talk about not so much short-term emergency response and the disaster response, since that's not really my area of expertise, but talk more about the medium and long term in terms of healthy homes, resilient design, and adapting homes for climate change, and I'm currently working on that in terms of extreme heat. Thank you for inviting me and sharing a lot of useful information. Let's see. I'm going to have to read from this thing here and do both. Oh. Okay, when I was thinking about emergencies and disaster recoveries, this reminded me of my youth working as a student fireman, and lo and behold, I found a picture of where I used to work, a rural fire department. These were good old boys, tomato farmers, wheat farmers, businessmen, politicians, a few ne'er-do-wells, and these are the lessons I learned in thinking about it. I started out, well, let's do the 3 R's. Well, it became 5, so readiness, training and improving constantly, using warning systems like fire days. Reliability, test and maintain equipment routinely. Response time, use a yardstick or a performance metric. Relationships, work and play together as a community. We had some good barn dances and parties and stuff. Refreshments, stay hydrated, that's good for extreme heat, and keep beer on tap at the station. So I think this has a lot of relevance to post-disaster recovery, not just first responders. I should mention that that's Chief Carl Tiley on the left. He was a tough old Dutchman, but he made sure the job got done. His favorite saying was, in your spare time, can you go please fix and clean something? So here's a summary of what the programs I worked on, real briefly, because we were going to have 15 minutes, now we have 10, so I'll skim through some of this. But basically, I worked on sustainable green building programs for office buildings, for schools, and then it morphed into residential. And we were lucky that the stars aligned and the state architects screwed up in making a green building for the Cal EPA building of all places. They called us in at the last minute when I was working in the indoor air quality program and said, what do you think? And we gave it 2 thumbs down. And we had to move in there and do some fixes to it. But that got the legislature quite angry. And they then said, you will now form a green team, a sustainable building task force with all the different environmental agency experts in there, and it'll be cabinet level. You will come up with a design for the next big state building. That became the template. And the state architect hated us at the time. He said, you're my new best friend, and just about spit on me. Afterwards, I have to say, we were pretty successful. There's a lot of compromises. But in the end, he became a true believer, kind of like a former smoker. He was a great evangelist for this type of approach because it saved him a lot of money and hassle in the long term. The bottom line was we had the executive order, we had funding, some minimal funding, a lot of staff time, and we did some good demonstration projects and rapid implementation. The next 2 things for schools and the residential were more NGO type things where we volunteered staff time on technical committees and so on. And the good news is that all of these kind of green type projects, we basically started with LEED and then put it on steroids. We made it much more aggressive, much more health protective. And this was starting back around 2000. And now a lot of these things are being phased into the mandatory building standards. And resilient design, as of last fall, was starting to be considered for updates on the schools program. And I'll talk about resilient design some more. Let me see. Now here's the lessons I learned, and we can probably stop talking after this. But I mentioned high-level political support. It breaks a lot of barriers. It gets the attention of the decision makers and the funders and so on. Legislation also helps. We later had AB 32, climate change legislation, which came up with action plans which included green buildings. So there were some committees and task forces dealing with that. But that has moved much more slowly, especially with retrofitting of buildings, excuse me. Let's see, I guess I forgot those, huh? The other key things would be that funding can happen. You can piece together a lot of different sources and get in volunteer efforts and make some headway. A small number of dedicated experts can efficiently produce a defensible, useful product and make a big difference. It got much muddier once all the special interests became involved and the non-experts came in and all these other hassles evolved. Health, this is probably one of the key things for this committee, I guess, and this group. Health must always be at the table and provide supporting rationale and evidence to show why this is important and create that dialogue and train the other stakeholders. And also, I guess you almost have to be nosy and snoopy and keep your ear to the ground for different programs that are related to these issues that haven't even considered health but should. Early user feedback is on feasibility of the different measures you're considering and trying how far should you start raising the bar. Can that really be done? Is it going to cost too much or be too hard to do? That's really critical. It smooths things, smooths the tracks quite a bit down the road. And then model codes, finally. When you come up with these volunteer programs, the model codes and best practices and guidelines can be adapted and used rapidly by local government, private sector, and they can be tweaked as needed. And the first example I worked on was the smoking bans in California at the local level. We helped them with that. And that became very successful because it spread like wildfire around the state and eventually other places. So, post-recovery home health issues. This is all kind of basic, usual suspect stuff for indoor air quality, and there's a lot of good programs out there already from HUD, from National Center of Healthy Housing, from EPA, DOE, and so on, that are doing not just straight insulation and so on, but they're being much more careful to address these different kinds of pollutant issues and the sensitive populations like the asthmatics. And there's a lot of good evidence out there around the country, and HUD's funded a lot of it, where you do these healthy home demonstration projects with low-income and asthmatic families. And by keeping them out of emergency rooms and in schools, you get a huge savings that justifies getting a certified healthy home contractor in there. And that has now become reimbursable under the Affordable Care Act to have a certified person come in, and it's really growing in the Northeast, and that's a real game changer right there. So that's I think pretty established and moving forward. It needs to be expanded a lot, but that's very encouraging because it took years for that to really happen. And once again, it's the stars lining up. Affordable care, who would have thought, you know? Because the early pioneers tried to get HMOs to buy into it, and they got very little traction. Okay. With new construction, that's kind of a slam dunk, at least in California, because our goal is already to get to net zero energy by 2020, and I'm hoping that other states are going to be moving there, you know, in the same time frame. So if you're doing new construction in a disaster area, even if your state isn't there yet, it's probably a good idea, if you, any way you can finagle it, to leapfrog ahead and get ahead of the regulatory requirements. And for the homeowners, it actually tends to increase their home value based on some surveys that have been done, and they save money in terms of energy and better health and so on. So the general trend in trying to get to these real low energy designs, especially in new housing, and we're following the lead of a lot of European research, is to, unlike the 20th century where you have a lot of motors and fans and controls and so on for your heating, cooling, and ventilation, if you even have ventilation in a home, which you don't normally. And these things are all equipment that fails sooner or later and that rarely gets maintained. In some of the surveys we did, people rarely even change their simple air filter, you know, a $2 filter. So the trend is to more passive, resilient design and durable, so you reduce your energy costs, your maintenance costs, And when you run out of power, which is becoming more and more common, it'll keep you safe for longer. So what's resilient design for buildings? Well, it's kind of an evolving, vague definition, but one that I've seen is it seeks to create buildings that will provide safe shelter and basic functions during extreme events. So it's, you know, heating, cooling, water, food, whatever, communication maybe. And so some of these post-disaster plans and resilient plans by New York City and Boston and maybe New Orleans, I know they've been talking with some of these discussion groups that I'm in about it, are trying to push forward on resilient design and prevent some of these future problems at the local level. And also, I've heard that in California, one of the green building groups is trying to incorporate some more resilient design into the residential guidelines. LEED probably is too, but they tend to be slower. Now, there's a similar concept that overlaps called future proofing, which came maybe more out of Europe, but a lot of different industries use it, and they basically say, well, how is our facility or building or whatever going to hold up in 20, 30, 50 years, whatever the lifespan of your building is. And so a lot of buildings last to 100 years or more if you take good care of them. And we know the climate's going to change drastically, at least I would bet on it, most people would. So when I looked at the state building standards, it turns out the weather data they were using was 10 years old, and they weren't even considering new climate projections. They've since put out some research funding, and they're working to get more information on that, figure out how to do it. And there are other groups that have been doing it for now maybe a few years in UK, and they, I can give you examples and references later. But basically, I've been focused on the heating issue, and I'll explain why in a minute, but you can also look at, extreme heat issues. But you can also address things like precipitation, which isn't modeled quite as well in the climate models, and wind and sea level rise and so on. A lot of agencies are already, looking at sea level rise and how to deal with their land use problems there. So I'd say both approaches are evolving rapidly, this future-proofing and resilient design, but it should be quite exciting. In terms of climate change, it's not a classic disaster where you have this compression of time and so on. It's almost the opposite, and that's a problem in human perception and response. Well, I don't have to worry because it's going to happen in 50 years or whatever, and I'll be gone. Well, you'll see in a minute that's not really true anymore as far as we can tell. But as it is, why should we worry about climate change? It's the #1 killer in terms of weather-related disasters. It swamps the other types of weather disasters. Economically, it may not be as big as flooding and things like that. But, this is compared to a lot of environmental risks. This is a fairly big number, this 1,500 to 2,000 per year, and that's just on average. And it's probably going to get worse unless we really deal with it. And I'll get to that in a minute. And now, climate change, as you probably know, is exacerbating this problem. We've got a multiple whammy, and not only are we getting bigger, longer heat waves and more humidity, and we're seeing some of that already, and it's projected to be worse. But at the same time, we're often getting worse air pollution, wildfires, which cause all kinds of havoc and more air pollution, and power outages. So you lose your cooling in a hot climate. That can be devastating. Also, the morbidity impacts can be substantial from climate change. There's a fair amount of data coming out on that now. And I'll share my slides with you, I guess. I'll just mention metrics briefly because a lot of people did, and I mentioned it about the response time for fire departments. And I'm working on this issue now in terms of indoor heat, in terms of how to measure it and what's a safe level and so on. And so the basic question whenever you have a metric is the usual why, when, where, and how to measure. And then how will the results be used? Will you really use them, and how to really leverage them and make them help you solve the problem? So there's some research on this in terms of overheating and extreme heat impacts on buildings from existing problems as well as future problems. And you probably heard us saying, at least in the building and energy industry, you only measure what's important. And usually that's something that costs you money, because you can easily measure money, or you can measure electricity usage or gas usage. The problem with health is there's not an easy metric. You have to work hard and dig hard to find out how many people did you keep out of the hospital, how many people lost days at work, and so on. So that's always been a battle with these green building groups when it comes down to dollars and cents. But if you could even put some rough numbers or just the general concept in terms of the human impact on the quality of life and of sensitive populations, that was a good selling point for a lot of these green building programs, because the public and the politicians go, oh yeah, that's important. So Kelvin actually said, when you can measure what you were speaking about and express it in numbers, you know something about it. So there's kind of this conundrum. If you don't measure, you don't really know what's happening, right? That's the other energy principle, energy management principle. You've got to track what's important and then make sure that it's going the way you want it. I was somewhat surprised that Lord Kelvin also was a friend of the bluebird of happiness. I think in social networking, he said, to live among friends is the primary essential of happiness. And we'll get to that in a minute. How am I doing on time? Vulnerable populations, we heard a lot about that already, and I've pulled together a lot of national numbers and projections here. The bottom line is that one of the highest numbers here in current prevalence of vulnerable persons to extreme heat is the obese adult, and it's currently 36% and higher in some regions in the U.S. They don't know if it's going to grow anymore, but it's grown a lot in recent years. And all these other metrics have grown a lot in recent years. And there's a new paper out from UCSF on social isolation. They use a metric that showed that social isolation with this combination of about 4 or 5 variables is a good independent predictor of cardiovascular disease deaths, and it's equivalent to, I think, was it environmental tobacco smoke? So that means, you know, there's really something going on there in terms of health, and we kind of knew that, but they're working out better methods and metrics, I think. Now, also, many people have many of these risk factors. They call it comorbidities. And so if you looked at an elderly person in a nursing home with diabetes and obesity and high blood pressure, you know, they're really high risk. So that's who you see ending up, you know, as victims of heat waves or hospitalized and so on. So this is really, when you look at the climate change and other environmental impacts coming down the road slowly, and then in the next, I guess, 10, 20 years, and out to the end of the century, we're going to have this baby boom aging out, and they're going to get sick and fragile, as the medical term is now. And we've got a perfect storm. We've got climate change brewing, and so it's a perfect storm for public health and housing. Here's an example of just heat wave projections. You've probably seen some of these, but this really surprised the researchers, and it got my attention because I used to think, well, by 2050 I won't be here, but I should worry about my kids and grandkids. But when I started looking at some of these recent models, they're looking at extreme heat waves, worse than the historical record in the last half of the 20th century, like the worse than we'd had before, over the decade. And if you look at the left, they're projecting, you know, like 0 to maybe 3 per decade. That's like every 3 years. And these are, you know, really bad ones for this decade we're in now. And in some regions, by the 2020s, they're going to have at least 5 decades per year. That's 1 every other year. You know, I'm not sure I'd want to live in a place like that, because I live in Northern California, and, you know, we get maybe 1 severe heat wave every summer. It's about 2 or 3 weeks, and you maybe go to the mountains or the beach if you can, but otherwise you just hunker down, and you go outside, and it's like being hit with a blast furnace. And we're not, if you go to Southern California, it's even worse. If you go to Phoenix, forget it. And I've had, anecdotally, I've heard of people that in Phoenix and even in the Bay Area on a hot day, they're inside their house trying to stay cool, probably don't have air conditioning in the Bay Area. They can feel the heat coming through the walls, just radiant heat. Probably, you know, at least they were young and healthy and could survive. And then in this model here, the eastern states could experience up to 4 extreme heat waves per decade towards the 2030s and so on. So that means that the buildings that you build now will be hit hard with heat waves probably in the next 10, 20 years. Now, some people have, around the world, have started mapping the projected heat waves, and they overlay that with housing and census data and vulnerable people and so on, and they come up with maps. This is one of the best I've seen, where they have good data on the thermal characteristics of the house insulation and roof and walls and so on. And then they piece that together with census and data on age and health condition and other risk factors. And they overlay that to get the bottom graph where they can isolate future hotspots for the most vulnerable buildings and occupants. So then they can really target their retrofit and mitigation efforts that way. There's a lot of work going on around the world like that, but this is probably the best one because a lot of them don't have good housing and building data to get that final piece. But
Thomas, we'll probably have to start to get to the recommendations.
But some people are doing aerial surveys and can actually pinpoint.
Yep.
So the good news is, I'm going to skip to my recommendations because this is basically all the benefits of doing green, healthy, future-proofing type design. I've got they asked me to do 2 top priorities, kind of checklist type things, and I'm not sure I could quite meet that request because there's so many things that need to be done. But here's what I came up with. This is a whole house integrated design, which just means you integrate all the different factors of the building and the diurnal and seasonal variations, and you model just how well it all works together. And this is the house I built for my mother-in-law in the backyard. She said it was too hot, so I put in an air conditioner. So my real recommendation, number 1, is short-term, easy, low-cost adaptation to extreme heat. I mentioned all these other weatherization programs that do insulation and pollutant control and so on. But there's some other things they could probably just add on fairly easily, just some quick and dirty, easy shading, and even outside of these programs, you could encourage people to do it or provide minimal funding to shade their the windows that get the most beating from the sun, the south and the west usually. And you can even plant deciduous vines so that in the winter you get sun coming in to keep you warm. You want ideally something that's removable in the winter. And so awnings and shutters would work. Some of the newer high performance windows are more expensive, but you know, those are pretty nifty too if you get the right type of window for the right application. Ceiling fans in bedrooms helps a lot because especially say the elderly or something, they're in their bed and it can get kind of warm and they spend a lot of time there. It doesn't cool off at night and their body doesn't have a chance to recover. You need recovery time to avoid getting stressed out on the heat. And then number 2, this is kind of a stepwise process, medium and long term, identify and mitigate high-risk buildings. And you have to start by doing those kind of vulnerability mapping exercises that I talked about, or some kind of risk assessment, vulnerability assessment to figure out where the high-risk populations are, where to target your efforts. So that's where to start. And if you can, you know, definitely consider health status. The other kind of data, age, income, home efficiency and so on is more readily available. Then develop the appropriate mitigation measures for those kinds of populations and buildings that you've identified and design for future climate warming over the building life. Also consider neighborhood level strategies where you have emergency power supply from a photovoltaic system that people can share, or you have a cogeneration facility in the neighborhood. In fact, I heard that NYU Hospital provided power to some neighboring areas to keep their food from spoiling and so on. There's now eco-districts like in Portland and other parts of the world now where they share water and power and other things. So they're kind of little islands of self-sufficiency. And then conduct demonstration projects and show that it works and debug it and try to spread the word. So by sharing these experiences, these model programs, and sharing data, I think it gives people a lot of hope and encouragement. And finally, I mentioned before the model codes and best practices. Those are something that people can just take off the shelf, which is what I've seen a lot of emergency and other programs do, especially at the local planning level. They just want an off-the-shelf, easy type thing they can plug into their program and say, yeah, we've done a good job of controlling greenhouse gases, or this is that. They're not very critical of it. They want something that's easy and has been vetted. So that is the kind of the stepwise process there, and you have to start somewhere. So thank you very much for your kind attention. Here's some more information, and I'll leave you with this parting thought. If you live on the East Coast, you're not immune to heat waves. This is a more recent study from University of Tennessee, and they're looking at the increase in heat waves per year, and they're using a historical average baseline of something. And you can see that by the, I think it's the end of the century, the 2090s, the Northeast is going to be as hot as the Southeast, basically.
Wow. Thank you very much. Provocative. All three presentations. We do want to take